you? I'm Dr. Dieno. I'm Chief Medical Officer of Expert Care Incorporated, Expert Care, and we are a pediatric telemedicine company. And every Tuesday I come to you and I talk about a common pediatric topic. And today we are talking about constipation, infant and childhood constipation. It's very, very common. We get asked about it all the time. And we like to joke around that 80% of pediatrics is about the poop. And so, I've just been trying to think of some common pediatric topics to talk to parents about, things they have questions about. And if there's anything you would like to hear about, any additional recommendations, we're very interested in what you have to say. And so drop those questions, drop those additional comments in the comment feed. Very interested in people's opinions. I love to teach. I love to talk to families and parents. And I do this because it's fun, but also because I really want to educate families and parents on normal versus not normal in infancy and childhood, and just help parents feel better and enjoy the journey. There's so much fun in being a parent. There's so much to enjoy. So let's talk about constipation. Okay, I'm going to try today to keep it mostly infant and childhood, and kind of more the common pitfalls and pearls, definitions, what's normal, what's not when we're talking about constipation. Some of the questions have gotten into more intense behavioral questions around constipation. And that is something we can talk about a little bit more. It falls a little bit more into the toilet training realm, toilet training issues. And that's definitely also something we can talk about. If you want to do a separate talk just on toilet training, we can absolutely do that too. So let me know in the comments or directly message us, and we can do one that's just toilet training if you're interested. Okay, so what is constipation? It's a little bit different for infants versus, say, kind of preschool, school age kids. So we're going to take them in two separate groups. All right, so infant constipation. One thing that's really kind of common to both age groups is I'm not worried so much about the frequency of stooling. I'm worried about the consistency of it. What we want is a nice, soft stool at least once a day. Okay, soft poops are good. Hard poop is bad. Soft poop every few days is great. Hard poop every single day, that child is still constipated. All right, I don't care that they're pooping every day. And so that's kind of one big divider or rule that I like to talk to parents about. So babies, believe it or not, can definitely have days between bowel movements, okay? An exclusively breast milk fed baby can go up to about a week without having a bowel movement, believe it or not. Babies' bodies use breast milk so efficiently that it all goes into making the baby and very little goes into making the poop. Okay, so breast milk exclusively fed babies can go up to a week without having a poop, as long as that poop is nice and soft. When it does happen, that's fine. That's totally fine, okay? Formula-fed babies, typically if the baby has formula, especially if there's more formula in the diet, those kids typically go once a day, but they can go 1 to 2 days without stooling. Again, if that stool is nice and soft when it happens, that's totally fine. Breast milk fed babies, breast milk exclusive babies tend to have those more liquidy, kind of yellow, seedy, mustardy stools. Formula fed babies, the stool can be a little bit maybe more on the green side and a little bit more clay, like a little bit smooth, maybe more like peanut butter. But again, very soft. All right. Parents have a lot of questions about the color of a baby's stool. It can actually be a lot of different colors depending on what that baby's been eating. It's kind of impressive. The stool, again, breast milk stools can typically be very yellow and kind of mustardy, seedy. I've seen kids who have if they have a 4 milk imbalance, if they're taking off a lot of that thin milk mom is making at the beginning of a breastfeed, those poops can be green, like grass green. It's really kind of impressive. And I'm going to say that a few times during the talk. Baby poop, super impressive. It can be a lot of different colors, all right? But there are colors your baby's poop is not supposed to be. Your baby's poop is not supposed to be white. Your baby's poop is not supposed to be bright red, like there's blood in it. That's not okay. Your baby's poop is not supposed to be black, like black. Once babies are older, I've definitely had kids who eat a lot of blueberries. I love blueberries. But there are babies who eat a whole bunch of blueberries and their poops can be very dark appearing. But that's different than black poop. All right. White, red, black, baby poop can't be that color. All other colors are pretty normal. If you're worried about your baby's poop, just a quick sidestep, if you're worried about the color of the poop, talk to your pediatrician. Take pictures, bring it in. Either of those things is definitely far preferable to just trying to describe the color. All right, pictures are fantastic. There was a conversation between me and a couple pediatricians after that last talk. I don't care if people bring in the diapers for me to look at. Apparently every other pediatrician is super opposed to it. So pictures are also okay. So if you're worried about your baby's poop, let us know. No problem. All right, I was just trying to look over my stuff here. I'm cheating off of an old lecture I have. Just want to make sure I give you all the information. Now, a lot of parents will say to me, my baby makes the worst faces when she's pooping. It seems like it is really bothering her. And then I'll say, okay, totally understand that. What does the poop come out like when it does come out? And parents will say, oh, it's, it's soft. It's nice and soft. It's, mustardy, seedy, real soft, no hard bits or anything like that, no blood. That's fine. That is okay. That is something that's straining and grunting and looking like they're having a lot of issues. That's something we call infant dyschezia. And it's more a function of kind of immaturity of the muscles, muscle coordination, things like that. I like to tell parents that stuff we do that comes very, very naturally is actually different and new and sometimes difficult for babies to figure out. They're brand new. It's all new to them. And so that includes things like trying to coordinate increasing intrathoracic pressure while relaxing the muscles in the pelvic floor, to allow the stool to move through. Okay, coordinating that stuff is kind of tricky if you're a brand new baby. And the other thing I like to tell parents is, when's the last time you tried to poop when you were laying on your back? Okay, what kind of faces do you think you'd make? And when you tell parents that, they seem to get the idea. If the baby is looking like they're having a hard time, my question is, what's the poop like when it comes out? If it's nice and soft, no signs of blood or any weird little hard pellets, good to go. That's all right. A quick note, we're about to get into causes of constipation in infants. But one of the things I'll talk to parents about who bring in their infant because they think they're constipated is, when did this start? Typically, I'll find that babies poop at least once a day, if not multiple times a day through the first months of life. And then we'll start to have some issues once we get towards the introduction of solid foods. And we'll talk about that in a second. But if this baby has never pooped normally, we're talking from birth, that first stool was delayed, and ever since then, it's been a real issue to get this kid to pass stool. That's an important historical feature for the pediatrician to hear about. Kids who have never, ever, ever pooped without an issue since birth, we worry about different actual underlying disease pathologies, problems with the bowel formation, the nerves in the large intestine, things like that. Okay, so we as your pediatrician definitely want to hear about if this kid has never pooped normally from the time they were born. Super important. Okay, so what causes an infant to be constipated? There's a few things. One of the most common ones is transition to solids. And that's because the infant's fluid intake seems to go down around that time. And then also they're starting to take in more food, but not necessarily super high fiber foods. There's a lot of rice cereal involved. That's not super high in fiber. We definitely will give things like carrots and apples, and those are great, but they don't have the most fiber for the pureed fruits and vegetables you can give to little kids. So transition to solids with its attendant decrease in fluid intake can cause an infant to become constipated. Cow's milk intake, once we get to, we're talking the 12-month-olds, can cause the baby to become constipated. Again, that seems to be more of a function of, decreased fluid intake, because typically once we start cow's milk, we're 12 months old and we're taking solid foods pretty well. And additionally, there are children who take excessive amounts of milk in. They love milk. Some kids just love their milk. If they drink too much milk, it can actually fill them up, so they're not hungry at meal times. And if they're not hungry, they're not going to be eating. Typically, they're not going to be eating the things that aren't as fun to eat as high fiber foods. Okay, high fiber foods typically aren't fun, sexy foods. Think about it. You're a grown up. Can you think of any super fun, high fiber, sexy foods you want to eat? Probably not. Little kids love chicken nuggets and ketchup. They're kids. And they're not super interested in whole wheat bread, prunes, stuff that's typically high in fiber. Okay, so cow's milk intake, excessive cow's milk intake decreases fluid intake, decreases the intake of fiber-rich foods, and it can slow some intestinal motility, which increases constipation. And then anal fissures, okay? Some kids get a little tear in their butthole when they get constipated. That's painful, all right? And it will lead to stool withholding behaviors, okay? The last time I pooped, it hurt. I don't want to poop anymore. I'm just going to hold on to this till I don't feel like I have to poop anymore. I always love to tell parents, kids aren't dumb, okay? Kids are not stupid. And if something makes them hurt, they're not going to do it. They're going to avoid it. Kids are fun. Kids are cool. Let me take a peek at the next slide that I've got over here that you can't see. Infant constipation. Okay, what do I do? My baby's constipated. What should I do about it? Okay, they only poop every few days, and my baby's pooping hard little rabbit pellets, and it really seems to hurt her. And I think there was a little bit of blood on one of her poops one time. What should I do? How do I fix it? For little babies, especially kids less than 6 months old, I'll tell parents, let's do 1 ounce of straight up fruit juice per month of life, up to 4 ounces of fruit juice. Okay, what we're doing with that, and the best ones are apple, pear, and prune juice. Okay, super high in fiber and super kind of high in sugar. Okay, don't be afraid. What we're doing is we're using that high, what we call a high osmotic load, to draw in water from the surrounding tissue and loosen up that poop, so it's way easier to pass. Once upon a time, before the American Academy of Pediatrics was way more stringent about how much juice we recommend kids have, we used to see something all the time called toddler's diarrhea. And what that was is, a 2-3-year-old kid would come in, mom would bring him in, and it would be, Timmy has loose poops all the time. He poops like 2-3 times a day. It's real loose. It's been going on for weeks. He doesn't seem sick otherwise. He seems okay. And when you ask the parents some more information, what you find out is that Timmy was drinking like 24, 36 ounces of just straight apple juice a day. Okay, that will give you the runs. And so when we say give an infant 1 to 4 ounces of straight juice, up to 4 ounces, we're leveraging that high sugar content to try to draw in water and loosen up that hard stool in that baby's large intestine, make it easier to pass on through. Okay, so infant constipation, we'll talk 1 to 4 ounces of straight juice per day. Apple, pear, prune are the best ones. Sometimes we'll give a medication called lactulose. You'd have to ask your doctor about that. Something we can talk about if dietary interventions aren't working. And another thing I like to talk to parents about is if your child is taking solid foods, in addition to the juice, let's up the fiber content in that diet. Again, pureed pears, pureed prunes, peas are also relatively high in fiber, believe it or not. And flax seeds, which are something, flaxseed meal, which you can, mix into most anything, that is very high in fiber as well. So let's up the fiber in content in that infant's solid foods, if that infant is taking solid foods. Oh, and I'd mentioned rice cereal before is not very high in fiber. You can switch over to kind of the more high fiber cereals, wheat, things like that, multigrain. Okay, so those are really good. Okay, let's talk about kid constipation. So more like preschooler kiddo constipation. We're talking those kids, what we're going to see is infrequent stools about 2 to 3 times a week. Preschooler kiddo school age kids, they'll come in and see me. I'll ask them, how often do you poop? Do you poop every day? And they'll be like, no. And then we'll try to figure it out from there. A lot of these kids complain of belly pain. That's often how these kids come to our attention, not because they're not pooping frequently, but because they always complain of belly pain to their parents. Sometimes it's very, very painful. Constipation is super painful, guys. Kids will have kind of crampy, more generalized abdominal pain. They'll double over. And eventually, they might need to lay down. They might need their tummy massaged. And then it kind of resolves typically. It's something we see a lot. It's a pretty common cause of pediatric presentation to the emergency room for abdominal pain. It can be very painful. Okay. I'll start asking these parents, is your kid super gassy? I once had a very wise pediatrician tell me a fart is a poop yelling to get out. Okay, not super scholarly right there, but when you say that to a parent and a kid, they laugh and laugh and laugh, and it sticks in their mind. It makes a causal association, and they can tie that back to a thing they need to work on. So remember, a fart is a poop yelling to get out. Also, I'll ask the parents, okay, when Shannon does have a poop, is it like pretty big? Like, would you say man-sized? And you should watch the parents' face. They say, oh my God, yes. Oh my God, yes. You would have thought my husband did it. That's what we refer to as large caliber stools, are an indication that has been sitting in that child's colon for too long. Often these stools are very difficult to pass, painful. There can be just a lot of straining needed to happen to make that bowel movement happen. And we can sometimes see stooling accidents, okay? Kids have stool in their underpants and they didn't necessarily even feel like they needed to go. They're ashamed, they're upset about it. The parents will ask you about it. And what has happened is that if a child gets constipated enough, that impacted stool will extend back through the large intestine, and then soft, liquidy, unformed stool will actually pass around that poop rock and leak from that child's rectum. Okay, that's called fecal soiling, and it's a sign of something called encopresis. That is very, very, very serious constipation, and that is something we definitely need to intervene with and follow as a medical team, parents, kid, and the PCM. Okay, alrighty. And so why do children become constipated as opposed to infants? It's some of the infant stuff that's pulled through into this age group. Okay, inadequate fiber intake. Again, what do small kids, what do school age kids like to eat? Fun stuff. All right, my toddler, my almost 3-year-old, loves Totino's pizza rolls. She loves bread and she loves cheese. Okay, she does not love kale. She does not love wheat bread. She does not love other high fiber foods. Decreased fiber intake, inadequate fiber intake is an excellent reason for smaller kids, for anybody to become constipated. Inadequate fluid intake is another great reason. Typically grown-ups, they're trying to be health conscious. They walk around with that Yeti, God dang it, I'm forgetting the name. I'm so sorry. It was big containers that keeps everything cold of water. They try to drink it. They're being real conscious of it. 3-year-olds don't do that. Typically, neither do your average school age kid, maybe not until they're participating in sports and really recognize the need to be hydrated, okay? Inadequate fiber intake, inadequate fluid intake. And again, cow's milk comes back into the picture. Excessive cow's milk consumption can lead to constipation due to decreased water intake and making that kid too full when it comes to time to eat those fiber-rich foods. So I drank a ton of milk, my tummy's full, I'm not hungry, I don't want to eat my bologna and kale sandwich on whole wheat bread. Or other good, nutritious, high fiber foods. That's why kiddos become constipated. And the other one that's important to talk about is stool withholding. Again, kids aren't stupid, all right? If I pooped and it hurt, I'm just not going to poop anymore. I'm just going to hold on to it. Kids, super cute, love kids so much, way too busy to do something as boring as sit on the toilet and wait to have a bowel movement, okay? Little kids, they've got stuff to do. They're playing with their friends. They're watching their show they like. They're going someplace. They don't have time for something as dumb and mundane as sitting on the toilet and having a bowel movement, okay? Pain, stool withholding, too busy, stool withholding. And another reason as you get into older kids is they don't want to poop at school. So they'll hold on to their stool while they're at school because they're weirded out about pooping someplace that's not home, okay? These are all common causes of constipation in the older kiddo, okay? So how do we treat constipation in the older kiddo? It's pretty similar to the infant, okay? We want to ensure adequate hydration. We want to make sure we are definitely drinking enough water. We want to make sure we're taking in lots of high fiber foods. And you know, I love to add in images on our Facebook page and on our Instagram page that related to the talks I'm giving on Tuesdays. I'm definitely going to do that with this visit. Lots and lots and lots of pictures and charts for families. We want to make sure our school age kiddo, our older kiddo, our toddler is drinking enough fluid. We want to make sure we're eating lots of high fiber foods. Okay. What I like to talk to parents about is smoothies. All right. I think they are the greatest parenting hack. You can fit so much stuff into smoothies. You can get in lots of fiber into a smoothie that tastes great. Throw in a couple prunes, but make it mostly strawberries and blueberries. Dump in a tablespoon of flax seeds, okay? Maybe kind of trick them and make it a non-cow's milk. Maybe you've got a thing of soy milk in there that's for you. Almond milk, maybe something that's just not dairy. And you can even dump some Miralax in there. We're going to talk about the Miralax in a second. But smoothies taste great and are an excellent way to sneak in a whole bunch of fiber on a kid. Really, really helpful. I did mention the Miralax. As a pediatric GI doctor told me in training, it's called Miralax because it is a miracle laxative. This company gets no money from Miralax, just to be totally clear. You know, Miralax is an osmotic laxative, like we previously were talking about using the osmotic load in straight juice to draw in the water and soften up your kid's poop. Miralax is a similar thing, okay? It's powder. You dump it in 8 ounces of whatever that kid is going to drink. You know, and get them to drink it down. And what we want to do is soften up that impacted poop and make it easier to pass. You know, again, totally invisible in smoothies. All right, smoothies are a super easy way to get that stuff in there. What we want to do is titrate the dose of Miralax we give a child to achieve 1 soft stool per day. Okay, I tell parents start with 8 ounces. Start with a 1 capful of Miralax powder and 8 ounces of whatever that kid is going to drink. Okay, do that a few days in a row. All right, our goal is 1 soft, easy to pass stool per day. Can we get the kid there on 1 cap a day? Perfect. That's that kid's dose of Miralax. Does that kid need maybe a dose in the morning and a dose at night because they're really backed up? That's absolutely a thing we can do. Kids who are super backed up, I'll tell parents, pick a weekend you're not going anywhere. Start 1 cap a day. We hit Saturday on that weekend. We don't have any plans. We're going to do 3 caps a day on Saturday, 3 caps a day on Sunday, and then take it back to 1 cap a day on Monday. The goal is to really loosen up that impacted stool, make it easier to pass. okay? One of the questions I do get asked is, how long does my kid need to be on this for? A very common misstep we see in kids who are constipated, parents trying to help them get not constipated, is not continuing the Miralax long enough or recognizing the potential need to go back to the Miralax, okay? Kids who have been extremely constipated, who've really fought with this for a long time, and who definitely the ones who have exhibited encopresis, that stool soiling around that big impacted stool rock in their poor little large intestine. Those kids, we'll say they need to be on Miralax maintenance therapy for up to 6 months, which sounds crazy. But when you think about the physiology, the pathophysiology of constipation, when kids get really constipated, there are sensors in your large intestine that sense pressure and tell you, ooh, you gotta poop. Okay, that's how you know you have to poop. Those nerve sensors in your large intestine that sense the pressure of the stool. It is possible to kind of fatigue those sensors, okay? If you hold on to that poop, eventually those nerves will stop transmitting that signal. And then the kid's like, oh, I don't have to poop anymore. That's not true. The poop is still there. They just can't feel that signal being sent by their intestine anymore. Do this long enough. Again, the smooth muscle that makes up the large intestine becomes flabby and loose and not good at doing its job anymore, which is squeezing in a sequential manner to move along the stool towards elimination, okay? What we need to do is make that large intestine, if your kid has chronic constipation, really issues, that encopresis, really bad constipation, what we need to do is allow the large intestine to kind of rest and rejuvenate and get its function back, okay? We do that by making sure that kid is having at least one nice, soft, easy to pass bowel movement every single day. We don't want that colon holding on to that stool burden anymore, okay? We don't want the child having accidents, but we also don't want them just kind of holding on to stuff anymore, okay? After 6 months, the idea is that smooth muscle that's gotten really fatigued and the nerves that have gotten fatigued in the smooth muscle have had a chance to rest and kind of go back to their original level of functioning again, okay? We call that Miralax maintenance therapy. Okay, and it's something, I've had to frequently coach parents through and re-educate them on, okay? If that's a situation you've encountered, your situation is absolutely not unique. Many, many times, yes, any pediatrician, any general pediatrician, many, many times we've encountered families he was on Miralax like a while ago, like a few months ago, but like we got past it and it was over. And now we're back to the belly pain and the not wanting to eat and the huge poops and only pooping a couple times a week. Okay, he got constipated again. It happens. It totally happens. And you don't think of it because we don't think our kid's going to be on medicine for like 6 months at a time, especially when it seems like everything's going okay. It makes perfect sense. But sometimes we do need to be on it for a more extended period of time. Okay, so this is typically the talk I give to families about infant and childhood constipation. Usually it's a little bit shorter than this because usually I'm talking about infant or I'm talking about childhood constipation. I'm not going through both of them at the same time. This is kind of more of a cause and effect physiology lecture. If people would like to have another talk more about toilet training or behavioral interventions for constipation, that's absolutely something we can do. Send me a message, through Facebook or through Instagram or in the comments, and we can talk about toilet training and more behavioral interventions for constipation. And if you have any other questions at all, super interested in hearing them. I do have, oops, I lost my screen. I do have a couple comments here. I did have one with Santos saying, my son is almost 4 at 10 months of age. We noticed he was having a hard time passing stools, crying, sometimes bleed. Oh, tried different things until we sent to a specialist who said give him mineral oil and has helped tremendously since then. That's awesome. Mineral oil is another one. Mineral oil is definitely another option for kids who are constipated. I've heard of that too. It's a little bit more of an old school one, but hey, just because it's old school doesn't mean it doesn't work, okay? I've got another couple questions. Is every other day or every couple days bad? When do we start Miralax? Okay, that's actually a really great question. One of the things we try to talk, what I've always tried to talk to medical students about and residents rotating through pediatrics is discussions about constipation should be part of your anticipatory guidance at well visits, okay? Alert parents to this possibility so they can be on the lookout. If your kid is having a hard time pooping, if your kid is passing massive stools, if your kid is having these frequent belly aches, but everything else seems okay, start asking about the poop. Are you pooping every day? What's the poop like? It could be a signal that your child is constipated. And I'm a fan of starting Miralax right away if you're worried about constipation. If you want to start with intense dietary interventions, that's fine. Okay. If we haven't reached the impaction and soiling stage, I think that's totally fine. To just try the intense dietary therapies. But I'm a fan of, Miralax to the best of our knowledge. And there's been some controversy in past years, but everything I ever learned and everything, I was ever taught and everything, the things that I've read in kind of more the mainstream medical literature is that Miralax is very, very safe. And if you want to start that right away, capitate to make sure your kid is pooping nice and soft and those belly pains go away. You not have to bring out the plunger every time he uses the toilet. I think it's fine to start that right away. Okay, a great question. When should I see a specialist? I'll start to refer kids to specialists if they come see me and the interventions I'm making as a general pediatrician are not helping at all. So if the kid's not doing great, we'll talk about intensive dietary intervention. We'll talk about Miralax. If the child is very impacted, we'll potentially talk about an enema. And I saw a question about enemas in the feed. Thank you for sending that. We'll talk a little bit more about it in a second. And then I'll check in with them more frequently to monitor how things are going. If my interventions as a general pediatrician are not achieving the desired result, typically within a couple weeks, I want to say within the first week, I really hope to be seeing at least one soft poop a day if we're really jumping on it hard, no pun intended. But if nothing we're doing seems to help, or if the parent is very, very upset and feels very, very worried or concerned, and would feel better if they talk to a specialist, that's when I refer to a specialist. So what I'm doing as accepted general pediatrics interventions is not helping, or if the parent is very, very concerned and doesn't seem to feel comforted by the interventions I'm recommending or the advice I'm giving, I'll typically refer to a pediatric GI doctor then. The third instance would be what we were talking about previously, a child who's never seemed to poop normally. Okay, this kid has always had issues. This child has always required assistance since birth. That's worrisome, again, for some sort of underlying disease pathology. That's a kid I send to peds GI to make sure we're not missing something, okay? Because if your intestines don't work right, because we're talking about issues with the nerves in them, there's no amount of Miralax I can give you that's going to fix that. We need to do something more. So that's the third time I would send to a specialist. Thanks for that question, Bev. How about mag citrate on children? I could, it's not something I've typically used. I would have to look into it, and I can look into that and I can respond to your question offline. It seems to be something we use more when we're doing a bowel prep or a clean out. This is a general pediatrician speaking. I typically don't use mag citrate for an average constipated kid, but I can look into that more and give you a better answer. I'll do that. What about glycerin suppositories or enemas? Again, fantastic question. Glycerin suppositories are something we can use in smaller kids, typically smaller kids, or enemas. Again, things we can use if the child is very impacted. Okay, that kid cannot move that poop. We'll talk about enemas. All right. Both of these things can be traumatic to the child, depending on how old the child is. When I was an intern, we had to rotate through a local hospital, local pediatric hospital's emergency room. Lots of kids came in with constipation. We gave a lot of those kids enemas, and little kids especially can't understand kind of the logic behind it. Hey, I know it really feels like you have to poop and that you're going to poop on yourself, but you're going to be okay. And the longer you can hold on to this enema, the better things are going to be. Talking 2- and 3-year-olds, even 5-year-olds through that doesn't really work. And it's traumatic. If you need to do it, it can be helpful. But enemas are absolutely not by any means first-line treatment for constipation, or something you should use regularly. Same thing with glycerin suppositories. Okay, can you break down the difference between Senna and Miralax? We use Senna for our child daily to keep her stool output the correct consistency. Thanks, Ms. Martinez. Okay, so Senna is a stimulant laxative. Miralax is an osmotic laxative. Senna and medications along the same lines kind of increase the motility of the smooth muscle that pushes the stool out. Miralax doesn't affect the motility of the smooth muscle rather, but it softens up that poop so it's easier to move out. Okay, I typically prefer Miralax over Senna because especially if that child is super impacted and that poop's super hard, which is difficult to get out, if you then put a stimulant laxative on top of that, that's a lot of bad cramping. And so a really impacted kid who's given a stimulant laxative only is not a good time at all. I'll tell parents for a lot of different things, if there is something that's working for you and it's not something that I identify would be harmful to the child and you're using the medication correctly, I typically don't have a whole lot to say about it, okay? If it ain't broke, don't fix it. And so a kid who, say, otherwise has intensive dietary intervention, so we've got nice soft poop, who seems to be doing okay on a stimulant laxative, I probably wouldn't have too much to say, but I prefer the Miralax if we've got a kid with hard, infrequent pooping. Okay, does that answer your question? Let me know. And I'd be happy to talk more about it if you need more explanation, no problem. Okay. What about lactulose over Miralax? Great question, Ms. Lindley. Thank you so much. Lactulose is typically something I see used in smaller babies, and Miralax is something we don't use in little babies. Okay, so lactulose would be something I've seen used in babies typically up to about 6 months old, and then starting around 6 months to a year is often where I see the Miralax come into play. And I gotta be honest, I off the top of my head, of course, Ms. Martinez, no problem. Off the top of my head, I would have to do a deeper dive for exactly kind of pharmacokinetics and things like that for you. But yeah, lactulose, babies, Miralax, older babies into kids. And that's typically where I see that happen. Okay, scrolling through any additional questions. Want to make sure I didn't miss anything. And of course, anything you guys post, I'll go back and double check it for you guys. And that's about all I've got for right now. If you think of anything additional and you want to drop it in the comments for this video, or you want to send us a message about it, or you want to schedule an appointment about it, clearly I love talking about poop. It really is something pediatricians talk about a lot, up to the point where one of my former colleagues was making poop jokes on this post when I was talking about my talk today. Thanks, Dave. But yeah, I love to teach and I love to talk to parents. And so I'm more than happy to try to figure stuff out for you. And if you'd like to just talk in person like this, you know, we accept TRICARE. Oh my God, I had a small stroke. TRICARE, Aetna, Medi-Cal, United Healthcare, and Cigna. That was the other one. Let us know. Oh, I had a great question. Sorry, one more. What about regular follow-ups for constipation? That is something that I will do dependent on the family. Thank you for that question. If it's a family that seems to be grappling a little bit more with the concepts, or seems to have a little bit harder time getting on board with the idea of the need for a medication, it's very much gauged towards the family themselves. There are some families who come in, seem to have kind of an aha moment when I go over the pathophysiology of constipation, and seem very much on board with the dietary modifications and the introduction of Miralax if that's not working. Typically, I'll give them handouts that I really like. I'll give them a supply of Miralax with 1,000,000 refills, 12 refills, I should say. And I'll say, give me a call if you're running into any issues or it's not working out. Remember, our goal is 1 soft stool a day. There are parents that's totally sufficient. There are some parents who need a little bit more intense follow-up. Okay, some parents can do okay with just a phone follow-up. Hey, just wanted to call and check in, see how Jimmy's doing since we started this. There are some parents that need that. There are some parents, particularly if there's some families, if the parent is a little bit more anxious, I'll say, if they're available, come on, let's book a follow-up in a week. Let's come in so we can do a more of a thorough physical exam on the child, weights. Maybe things are better face-to-face with the parent for communication. And those are families I'll have come back in person. So regular follow-ups for constipation, very much tailored to the family themselves. But it is something that can be needed depending on the parents and the kiddo you're working with. That was a great question. That was a really good question. Any other questions I can answer in the comments, in the DMs. Thanks for letting me talk to you today about constipation. Love talking to parents, love talking to you guys. Don't forget about my best friend, healthychildren.org, put out by the American Academy of Pediatrics for all parents and caregivers of kids everywhere. Lots of really amazing information on constipation and other very, very common pediatric questions. And I'll see you again next week. I haven't picked a topic for next week yet. If you have a suggestion for next week's topic, please leave it in the comments or send me a message. But we'll figure something out, and I'll see you back here next week. Okay, have a great day. Bye.